Good morning, guys. So it's December the 22nd, 2021. It's almost 6 o'clock in the morning and it's snowing outside. So let's talk about the different types of arteriosclerosis. So arteriosclerosis means thickening of the vascular wall. We have three types, three causes in which the vascular wall gets thickened. It's either atherosclerosis, which affects the medium and the large size vessels. This is really important, medium and large size vessels. And the pathophysiology here is due to inflammation, and there are definitely modifiable and non-modifiable risk factors. So the modifiable risk factors include too much, too sweet, too salty, too fat, or too smoky. So hypertension, which is too much salt, hypertension, diabetes mellitus, too much sugar, hyperlipidemia, too much fat, and smoking. So these are the modifiable risk factors, and the non-modifiable risk factors include age, sex, and genetic factors. And we'll talk about the complications. We'll talk about the pathophysiology in details. So it's either atherosclerosis or it is arteriolosclerosis. So from the name arteriolo means it affects the arterioles, so it affects the small vessels, and here we have two types. It's either hyperplastic or it is hyaline. We'll talk about it in details. And the third way is basically Mönkeberg medial calcific sclerosis. So this one does not result in a clinical stenosis. It does not result in clinical symptoms, but it's important because sometimes we confuse it with other diagnoses. We will talk about them in details. So let's see if I can draw here. Okay, yes. So this is the endothelium of a vascular wall. Normally it looks much better. And here we have a basement membrane, and then here we have smooth muscle. So what happens is that in atherosclerosis, lipid or LDL will come in this direction. So in the subendothelial space, and then it will be oxidized by macrophages here, and then once it gets oxidized by macrophages here, it will stay trapped here in this space, so it cannot leave, and then the macrophages will try to engulf it, will try to phagocytose these oxidized lipids, and the macrophages will form foam cells or lipid-laden macrophages. Foam cells or lipid-laden macrophages. And then these macrophages, because of the inflammatory response, because remember atherosclerosis is an inflammatory response, because of this inflammation, so many growth factors will be triggered. One of them is platelet-derived growth factor and fibroblast growth factor. Fibroblast growth factor will stimulate the growth of fibroblasts, and then these fibroblasts will form fibrous tissue, and the muscles, the smooth muscles here, will also proliferate, and this would result in a fibromuscular cap. So fibroblasts produce the fibers, and the muscles will also proliferate, and this would result in a fibromuscular cap. And because of that, there will be narrowing of the vascular wall due to the formation of atherosclerotic plaque. Now, what's the problem with this atherosclerotic plaque? The first complication is definitely organ ischemia, because there is less blood going in this direction. The second problem is that when this plaque ruptures, usually the site of rupture is here at the neck of the atherosclerotic plaque. So there is a rupture here, and then there will be thrombosis here, and then there will be obstruction of the vascular wall, and this would result in infarcts. So we can see a myocardial infarction or stroke. The third complication is thrombus formation and then embolization, which would also result in infarcts. And the fourth important complication is the formation of aneurysms, like aortic artery aneurysm. So how does it work with aneurysms? Why do aneurysms form? So the thing is, when the vascular wall here is thickened due to the formation of a fibromuscular plaque, so normally the way the vascular wall is supplied with blood, it's from two sources. The first source is called vasa vasorum, so there are small vessels which run in the tunica adventitia of the vessel, and they supply the outer wall of the vessel with blood, and the inner side of the blood vessel is supplied by blood flowing in the vessel, so nutrients and oxygen diffuse in this direction. If you have a thickening of the vascular wall due to atherosclerotic plaque, because of this thickening, oxygen and nutrients cannot diffuse and supply the vascular wall, and this is why these muscles in the middle of the vessel will get ischemic, and because they get ischemic, they will atrophy, and then they will thin, they will die, and because of that, the vascular wall will get weaker, and because of the weakness of the vascular wall, there will be the formation of an aneurysm. So this is how an aneurysm develops. So like we said, it's an inflammatory response, and this is actually the rationale behind giving non-steroidal anti-inflammatory drugs. So I know one potential mechanism of action of non-steroidal anti-inflammatory drugs is definitely the inhibition of platelet aggregation. This is one factor. The other factor is that atherosclerosis is an inflammatory response. And if we give non-steroidal anti-inflammatory drugs, then we inhibit this inflammatory response. So keep this in your mind. Now let's talk about the second cause, or the second cause of vascular narrowing, or the second cause of arteriosclerosis, let's call it. It's called arteriolosclerosis. So basically this affects the arterioles, yeah? So it affects the small vessels, and there are two types, like we said. There is hyaline and there is hyperplastic. So in hyaline, well, this is the basement membrane, this is the endothelium. So proteins, and now in this case, proteins, not fat, proteins will leak and they will deposit here, and they will form these hyaline deposits. We see this in patients with diabetes and patients with hypertension. So patients with diabetes, they get non-enzymatic glycosylation of the basement membrane, and this will make the basement membrane leaky, and because the basement membrane gets leaky, proteins come in and they will deposit here in the vessel wall, forming this hyaline thick substance, which would result in narrowing of the vascular wall. In contrast to that, in hyperplastic arteriolosclerosis, there will be hyperplasia of the vascular wall, and this is seen in malignant hypertension, and the type of necrosis in the vascular wall is called fibrinoid necrosis. So this is really important. Arteriolosclerosis, it affects the small vessels and the arterioles. There are two types. It's either hyaline arteriolosclerosis, which is seen in patients with diabetes or patients with hypertension, and well, in these patients, when the vascular wall is when the vessel is narrowed, then there will be ischemia of the organ, and because of ischemia of the organ, then the organ will get atrophic. So we see this typically in the kidney, and this is actually the cause why patients with hypertension or patients with diabetes mellitus develop chronic renal failure. They develop chronic renal failure because of hyaline arteriolosclerosis, narrowing of the vascular wall, decreased kidney perfusion, and atrophy of the kidney. There will be glomerulosclerosis. There will be death of the glomeruli and sclerosis or fibrosis of the glomeruli. Camille-Steele-Wilson lesions seen in diabetics. The third type is called Mönkeberg medial calcific sclerosis. So this does not result in vascular narrowing. Organ perfusion is preserved here. The only significance is that these calcifications are sometimes confused for significant lesions. So this is basically calcification of the internal elastic lamina and also the tunica media, which is the muscular layer of the vessel. And because of calcifications, then the vessels will be less elastic. Yeah, and it is seen in elderly individuals. The problem with that is if this occurs in the breasts, then it can be confused for malignancy. So keep in mind when we do mammography in elderly women, one of the diagnostic criteria for malignancy is the amount of calcification. And this disease results in vascular calcification, and this can be confused for a malignancy. So this is an example of a hyaline arteriolosclerosis. So as we can see, this acellular layer which is narrowing the vascular lumen. Yeah, so as you can see, there are no nuclei. These are nuclei of other cells, but here there are no nuclei, and there is narrowing due to deposition of proteinaceous material. This is a hyperplastic arteriolosclerosis. So there is hyperplasia of the smooth muscles. As we can see, there are different layers of nuclei, and it looks like onion skin. It looks like onion. Yeah, this is hyperplastic arteriolosclerosis, and this is seen in malignant hypertension. And grossly, when looking at the kidney, it looks like flea bitten. So there are points of hemorrhage, or there are punctuate points as well, punctuate forms of hemorrhage, as if the kidney is bitten by so many bugs. So it's called flea bitten kidney appearance. Now, this is due to Mönkeberg medial calcific sclerosis. As we can see here, the vessel is tortuous and calcified, and these vessels will tend to become less elastic. Thank you so much to my mentor. Have a nice day.